to week 2 of the webinar series at Addiction Rehab Toronto. As many of you know, last month we had our first webinar series on the signs of addiction. This month we're going to be discussing the first steps in getting help. So I've brought 2 different employees and staff this time. Rhea, the psychotherapist that works here at Addiction Rehab Toronto, and Iggy, the clinical director of Phase 3 or Sober Living for the men. So Rhea, why don't you let us know a little bit about you, how you got into the field, why you love working here at A.R.T.
So I got into the field 7 years ago when a few people who were really important to me were struggling with addiction. I've heard in the past that curiosity fuels passion, and I just found myself very curious about how I could contribute to their sobriety and their recovery. So through that curiosity, I started to learn more and more and more, and then that's kind of what led me here.
That's amazing. Yeah. And why do you love working here at A.R.T?
I love the clients, actually. I find a lot of times through parallel process that I learn just as much as they do.
Yeah.
So it's very rewarding.
Yeah, it's an amazing group of people. Iggy, can
Yes.
you tell us a little bit about yourself, how you got into the field, and maybe even how you started working here at A.R.T or Sober Living next door?
I got into the field. My passion came from being a recovering alcoholic. I wanted to give back, and what better way than to get into the field? I had a lot of people telling me that I had a knack of listening to newcomers and directing them the right way, and being stern and in my beliefs on recovery. Gave me that extra passion to want to go to school, which I did at 46 years old. I went back to school and did what I had to do. That was 10 years ago. So, and ever since, I did my placement at another facility. And from there, I was hired to do overnight counseling, which people say, well, what kind of counseling can you do overnight? And I was shocked. I was doing more counseling than the guys in the daytime. But every day I was involved. I fell in love with the clients, and my drive became more of a passion. And as long as I know I'm helping somebody, that keeps me going every day.
Yeah, absolutely.
That's why I love doing what I do.
And treatment and sober living is obviously very different. So
Yes.
do you want to just speak a little bit about what some of those differences are?
Well, being in treatment, you're in that bubble of safety, if you want to call it that. Once they're done here and they've learned the tools that they need to know going into the real world, some aren't ready. So we're that transitional stage. They'll come to us and we take a little extra time in helping them with the coping skills that they've learned, how to set boundaries, developing a treatment plan, a recovery plan that's going to work for that individual, and hopefully help them to stick to it. So they're successful in recovery. And yeah, with the care that we give them and the tools that we help them brush up on, hopefully they're successful.
That's awesome. Yeah, I think it's pretty amazing. I mean, most of our team, I think we all have a personal connection to addictions or mental health, and I think it's an important part of it, having a unique set of understanding towards it. So last week we discussed the signs of addiction, and I thought it would be beneficial for us just to review what some of those common signs are. So maybe I'll give you both an opportunity to name 1 or 2. It can be emotional, behavioral, physical, whatever comes to mind first, Rhea. So don't.
I think risky behavior is a pretty observable sign of addiction.
What about you?
When they start isolating again, when they detach themselves from everybody, that's a pretty strong sign that something's up. Something needs to be looked at or fine tweaked again.
And I like that you're saying again, because the signs for relapse can look really similar to the signs of addiction prior to coming into treatment, right? So that's a great point. So today we wanted to talk about the first steps in getting help, whether it's, getting right into treatment or just getting sessions or starting the process. But before we start talking about that, I think we can all agree there's some pretty significant barriers in getting help sometimes, something like stigma, right? For people to reach out and get the support that they may know that they need and can't get because of certain factors. So, what about something like a cultural barrier in regards to getting help? Rhea, do you want to speak on that?
Yeah, I think sometimes other cultures view mental health and addiction as a weakness or a weak sense of character. It's looked upon as an inadequacy or being defective. And so often then people don't want to ask for help because they don't want to draw attention to it.
Yeah, absolutely.
Yeah, well, coming from a culture where drinking is a big part of dinner.
Yeah, great point.
I got from myself from past experience, why can't you just put it down, right? Why can't you stop? They don't understand the disease, part of the disease. They think, that you're weak, that you just don't want to stop, you don't want the help, you're making excuses up. So it's very difficult when you're dealing with culturals and trying to educate them on what addiction really is. And, for my parents, personally, it was a how can I put it, an icebreaker for my doctor or my psychiatrist to sit down with them and tell them what I was dealing with. And then things started making sense to them. So they weren't that hard on me anymore.
Yeah.
They knew I was just making excuses. If I was, it would have been easy, but I wasn't. And I'm glad that they realized that, and I'd like to think we offer that to the clients that we have now with their parents. I'm sure they're going through it the same as I did. Different time, same topic.
Yeah.
People don't understand.
Yeah, I mean, sometimes it's just about having the conversation and being aware or educated rather than this person not caring or not wanting to help, right?
Right.
Another thing too that I think could play a role in taking those first steps is gender. We offer a program here for both men and women in the treatment center, but the numbers are usually quite different, right? The majority being males. So I'm wondering if we can talk a little bit about any stigma surrounding, the roles at home, what men versus women do within their household, things like that, or social expectations. Yeah.
So I think that the expectations are different according to the gender and also according to their family dynamic. I think a single parent, regardless of what the gender is, would definitely impact their ability to reach out and come to treatment, physically come to treatment. In terms of the ways that society looks at gender and addiction, I think a lot of that is a variable is what their drug of choice is.
So drug of choice played a role in it as well? Yeah,
I think
For sure.
so.
Yeah, absolutely. You want to add on that, Iggy? How do you
I
think
find
change?
with the gender, especially in women, I've found in the past guilt and shame. That plays a big role, and that keeps them from reaching out and asking for help.
Yeah, absolutely.
Super mom has to be super mom. She can't be sick, and there's a lot of it. Unfortunately, ends up, much worse than it really is, right? Because they prolong the help because of that guilt and shame, right?
Yeah.
Yeah, I think that plays a major role
Yeah, I agree.
for both men and women, but I find more so with the woman.
Yeah, and I think maybe even their treatment length, right? 30 days is something that could be potentially manageable, but if they do need more time, sometimes that decision is also really difficult too because of the pressure of having to get back home, or the father's taking care of young children, or the children aren't aware that their mother is struggling, and just that honesty piece is really hard to get to as well. So I think it's an important point to acknowledge, because those barriers can be really tough and sometimes lead to this person or someone not getting the help that they need. So let's kind of move towards some of solutions or suggestions that we can offer our audience. With those barriers, maybe, what are some ways that people can work through them? So, maybe you guys can choose one of those examples, whether it's the DOC or gender or cultural norms that are influencing someone getting help. How do we kind of support a family in getting over those hurdles?
I think, age impacts that decision, right?
Yeah.
I mean, with women, a lot of women are part of the sandwich generation where they're not only taking care of their children, they're also taking care of their parents.
Yeah, absolutely.
So it's a hard question because that's where a lot of things come into play, I feel. But bringing the family and really having a unified approach, I think helps them feel supported and helps the family feel supported too as a unit.
Yeah, absolutely. And that can look like someone coming on site, learning more about a treatment center and the family, again, going back to that awareness piece and education to kind of say, listen, we told the story to professionals. They agree that there's, a problem or an issue here. We are now aware of this and have learned how to possibly take the first steps with our loved one. Is that sort of what you mean? Yeah. So the education part for families, that's a great idea. Yeah.
I bring my own personal experience. I think that when you approach people, I do some interventions. When you approach people and you're trying to convince them that they have a problem or the family thinks they have a problem, it has a recovering addict. It's always nice to know. And you get a better feel if the person talking to me understands where I'm coming from.
Yeah,
right?
Absolutely.
That plays a huge role.
So sharing some similar, I guess, characteristics with the person that's needing help?
With the family, with everybody.
So if I was a single mom, let's say, sitting down with someone and recognizing that it's okay, validating that it's okay to take time for yourself, or matching someone to a cultural similarity for them to say again that this is not a weakness. You can and deserve to take the steps to get the help you need.
And you're not alone.
And you're not alone, exactly.
A lot of them think this, why me? Why is this happening to me? And when you reach out and they see somebody that gets them and understands them, that wall comes down. Right?
Absolutely.
And then you get more of the real person and the person suffering.
Yeah.
And now they open up about what they're dealing with.
Yeah, for sure.
Now it's a lot easier to introduce for, treatment at whatever scale. Be it in bringing them to a facility or outpatient, whatever. I'm a firm believer in bringing them into a treatment center and doing the 30, 45, 60, 90 days, whatever they need. Outpatient, not too keen on that one.
And why is that?
As an addict, yeah, sure, I'll go to treatment today and then right out the back door and out to play my old game again. Unless I'm really serious.
Right.
If it's just to get the family off. You have to remember addicts are sick individuals. They're not thinking right. And their judgment is off. So if they're not ready, they're going to go to what they're most comfortable with. And that's their DOC. Even if it is, they're telling the family, I'm going to outpatient programming.
Yeah.
I remember my outpatient programming. My family would drop me off at the front door. I'd wait till they turned the corner and out the back door I went. And then meet them in the front. An hour later, meet them in the front.
Yeah.
It was great today.
Yeah. Well, I think what you're speaking on is the intensity, right? Is removing the person from that environment that, they have their familiar using behavior in, and taking them away from that and giving them an opportunity to relearn some skills and behavior.
Very important.
Yeah.
Yeah.
Okay, so again, going back to the first steps in getting help, we're kind of discussing the barriers that could exist in order for that to happen. Sometimes it looks really different. As you both have said, we have an individual who's ready to go to treatment and then an individual who may not be ready at all or may not recognize their behavior to be problematic. So why don't we discuss first, how would we get the first steps going for someone who's not aware, does not believe that they have a problem, but their family and loved ones are noticing some of the signs of addiction and are concerned for their health and well-being? How would we support that family and person to get into treatment?
Well, I would, as an interventionist, I would have the family key role members to that individual that are closest to that individual come together and express their feelings to that individual and what how their addiction is affecting them and the family as a whole. And then the consequences come up where, you know, if the person's active in his addiction or her addiction and it's at a critical point, you have to give these consequences where, you know, maybe they can't see how sick they are, but if the family is there, united and together telling the individual that they have a problem, that they see a problem, it gets them to at least, you're planting the seed to get them to think about it.
Right.
So an intervention from the family seems to work the best. And then the other way would be just, you know, self-knowledge that, you know, my life's not going the way it should go.
Right.
And it's all because of this addiction.
Right.
And once you accept that, getting help becomes a lot easier.
Yeah.
The denial wall comes down.
Comes down, yeah. Absolutely. But, you know, just so, again, our audience is clear, I mean, a common way to support someone who is in denial, as you said, or not aware of the severity of the problem or their use, would be something like an intervention. And that's something that yourself or our center, a lot of centers would hopefully offer as, you know, that first step. Another thing you mentioned, Iggy, was the importance of those consequences, right? So you're sitting down and you're speaking and you're intervening to say, okay, enough is enough. We need to stop this behavior. But part of that is it can't continue,
Correct.
right? And so that, as Rhea also mentioned, the importance of that unity with family is really, really crucial, because then we have to follow through or support the family in following through on those, you know, consequences, as you said, or boundaries that are put in place. And I think that process alone needs to be carefully selected, and, you know, families need to be working with professionals that have done, you know, interventions themselves and have experience of knowing, you know, exactly what elements to kind of include to not only support the family, but to set it up for success, you know, not jump the gun too early, and then, you know, that one opportunity that individual may have said, yes, okay, I'm going to come to treatment, is, you know,
I think if the family comes from a loving place and not a blaming or hurting place, they're a lot more successful.
Yeah, for sure.
You know, so it's very important that you prepare for that, right? And that's where I come in.
Yeah.
I help them prepare on how to deliver their pain that they're going through.
Yeah, absolutely.
I still get emotional from, you know, when it was my intervention. You know, I seen the hurt that I was giving that my family was experiencing. I couldn't see it. You know, at that point, I didn't care really.
Yeah.
But it's important when it comes from a loving place. It's easier for the person to accept it.
Yeah,
and receive it.
Yeah, absolutely. Did you want to add something, Lee?
Yeah, I think that by the time we get to the intervention stage, a lot of these like risky behaviors or secrecy, lying, a lot of the pain has been present for a really long time. And so collectively, the family's really hurting. That can sometimes overshadow the content of what they're really trying to say.
Yeah,
right?
exactly.
Without having the professional there to guide the conversation and to have it emotional, but not reactive, coming from a real emotional place.
Yeah.
Right? Yeah.
Exactly. And again, the education is such a key point. And I think that for families, you know, who may be watching this web series, you know, an intervention is obviously ideal, you know, and that's again, including professionals that have done it before. But as you're saying, Rhea, I mean, it can be just the collection of so much, you know, like sadness and hurt from the family and despair that, you know, they need to be at a point. So encouraging families, if it's not a full-blown intervention, call a center, call Addiction Rehab Toronto, call whoever you're, you know, close to or comfortable with, and kind of just ask, like, this is my situation. Can I say this to them? And still set those boundaries in place so that at least the individual is seeing that the behavior is a problem. It's causing, you know, hurt and despair to people that they love, and that it can't continue. right? And then whether it's going to be that day or a few weeks later or a month later, you know, maybe that individual is going to, you know, really consider those consequences and want to make the change, right? So just don't want families to feel like it's only this full-blown intervention. You can do some work on your own as well, depending on the situation. Obviously, you know, getting that extra support is really, really important depending on the severity, right? Or the relationship, or again, those stigmas. Sometimes families, you know, if they really are not believing in mental health or getting help, you know, they really do need that extra support, like someone like Iggy or Rhea or myself to come in and say, it's okay, we're here, we can all talk about this and look to the solution, right? So I think that's those are all really great points. Another part, so guiding more into getting into the treatment center or getting the help, you know, there's a lot of different options out there for families, and you know, it's overwhelming. You have private versus funded, you know, different approaches that are included. So why don't we talk specifically about, you know, how we can help families that are watching to choose the difference between a private or funded facility. At Addiction Rehab Toronto, it is a private facility, and I think that there's a lot of really important benefits to going the privatization route, but let's maybe talk a little bit about those pros and cons. So Rhea, what would you say are the biggest differences between a private and a funded facility?
Well, I would say money is the most obvious one, and also programming, I think. So at least when you come private, the cost is extra, but I feel like you can have more diverse therapies or approaches, and that allows you to be more client-centered. So not everybody's treatment is going to look the exact same because everybody's coming from different perspectives and different paths. Having a client-centered approach is really beneficial, I think, and I think that's like one of the main benefits of doing private.
Yeah, absolutely. Iggy, what are your thoughts?
I tend to lean towards the private for the simple reason it's the ratio client to
Staff,
to staff. In a private setting, you're going to get the attention you need. It's not like a government funded place where they just jam these facilities with, you know, and the ratio is like 8 clients to one counselor. There's no way that individual is going to get one, the care they need, and 2, a program that is client-centered. They're just going to follow one basic program for everybody.
Right.
And that's why the ratios, the success rate is not to our favor when we look at numbers. Whereas a private, you know, you have less people, less clients, to the amount of counselors that are needed, like 1 to 3. I believe our rate is 1 to 3.
Yeah.
So 3 clients to a counselor is realistic, and it's more successful, and they'll show in the client when they leave treatment. They'll have a proper exit strategy. They'll have a proper treatment plan. They'll have the support they still need when leaving, like aftercare and all that good stuff that's available to our clients. Most government funded places don't have that.
Yeah.
They send you off to a private place to get aftercare.
Right.
So yeah, in regards to a personal preference, I would lean towards the private care, only because of the sole reason is I would get a more client-centered approach, whereas just a body being in a facility, and I've worked in both, you know, where you see the difference in the clients when they're out there in the real world.
Yeah, absolutely.
Yeah.
Okay, so just going back to the programming piece, because, you know, I mean, the funded option is still, you know, an adequate option. I think the biggest thing, and since we're talking about taking the first steps today, is that first step is so pivotal, right? I mean, if someone's going to decide to take, you know, the steps to get better and address their addiction and want to go to treatment, a lot of times that's a very time-sensitive decision, right? So I would say, I just want to add, you know, public versus private, in a private facility that there's no wait list,
Yeah.
right? So you can really act upon and take those first steps as quickly as you need to and when you need to do them. Whereas if you're in a funded route, you know, you can absolutely do the intervention, kind of look for a place that may be fitted to the person, but then have to wait, and you don't know what's going to happen from that couple of weeks to couple of months of getting into the center. And because we are, you know, when all is said and done, dealing with a life and death situation, that biggest step and that first step, I think, is so important, right? Because it can keep someone safe. And then just going back to the programming that you both mentioned, which I think is great, you know, again, with funding, and we're certainly not here to say that one is bad and one is good, but just to talk about the specific elements of them. You know, in funded facilities, we do get stuck in this third party, right? It's not the counselors to the clients, it's, you know, the government to the counselors to the client, right? So we've got to acknowledge that third party, and sometimes that slows things down. So it can increase, you know, the ratio of clients to counselors. It can decrease the client-centered care. You know, it can not keep an intense, you know, program that's client-centered and also inclusive of, you know, family sessions or couple sessions or whatever it is, and it needs to be designed for the specific person. It's all kind of slowed down with that third party. And in private facilities, we don't have that third party. It's just, you know, the staff and the client. And I think because of that, it can be a much more direct line of help. Right? So it's almost about efficiency. It's not about one being, again, better than the other, but it's just efficiency, I find. Do you guys agree, or want to add anything on that? Or
No, I agree.
Yeah, I agree.
yeah. So pros and cons, right? You know, private, there's the con that it's money.
Yeah.
And it's usually, you know, a significant amount of money, but again, at least in that way, you know that the money is being put towards something that's intense, client-centered, original programming that offers, as you mentioned, Iggy, you know, lifetime aftercare. We want to really strongly encourage people to look for facilities as well that are accredited. Addiction Rehab Toronto was recently accredited, but this is important because that means that the organization is held to, you know, standard safety practices and clinical practices too, right? And just ensures that, again, the individual is getting the help that they need. So we talked a little bit about the person that doesn't want to get into treatment, or maybe is not yet accepting of getting help, but we haven't gone the other route of someone or a loved one who is aware that they have a problem and is willing. They're willing to get help. So what can we offer to our audience as some suggestions in that scenario?
We'll get them to the treatment center
As quickly as possible. Yeah. But what would that look like, Iggy?
Well, if let's take an intervention. If the client's willing to go, you don't waste no time, because from an hour it could change. You know, addiction is that cunning and baffling that it'll tell the client that you don't need it when they truly do need it.
Yeah, it's a great
So
point.
once you get that okay, I'm ready, don't waste no time. You get them, put them in the car and get them to the treatment center.
Yeah.
That's the only way to do it,
Yeah.
in my eyes. And I wouldn't wait around for, oh, let's go tomorrow, I got things to do. Things can get taken care of by the family while they're getting the help they need. You know, I find that that's the number one rebuttal, objection that you get. You know, well, I got a lot of things to take care of before I go. Don't worry about that. The family will take care of that. Let's go now.
Yeah.
You know,
Exactly.
once you got them agreeing and wanting the help, waste no time. That would be my best advice to the loved ones and the individual, because the disease will play with his mind or her mind for sure.
Absolutely. Yeah, and just going back, because I just want to talk a little bit about, we're not doing the intervention route, and you know, this individual and family are all in agreement that they need to get help. I think some of those first steps would, again, be contacting, you know, a treatment center and ask the center to come in for a tour. You know, at A.R.T here, we offer those free tours that, you know, you can come in, see the grounds, talk to some of the staff, speak with myself, the clinical director, and, you know, just learn a little bit about what's been going on and see if it's a good fit for the family. I mean, we want it to work for the family. That's an important piece too. And we want the individual to feel comfortable as well. So encouraging their involvement in the process, I think, is really key. And again, if they're aware that there's a problem and they're willing to get the help, then they should be part of that decision, right? It's if it's going to be money, let's make sure we're spending it in the best way possible with a place that feels the most comfortable to the individual. So, you know, we have a willing person, contact the center, book that tour, sit down with someone, learn about it. See if your loved one can ask their own questions. Look for a place that is client-centered, so, you know, any questions or concerns or specific, you know, issues that may arise can be addressed or will be addressed. And you know, some of the other things we've mentioned as well, lifetime aftercare, you know, continued involvement and support post-treatment is really important. So I don't know if there's anything else you guys want to add, but I think maybe we can just have a few final thoughts and conclude the webinar for today. But
well, in regards to, you know, intervention or no intervention, yeah, it's important to be comfortable where you're going. A lot of families, I find, start doing the research for the individual before they even approach the individual, which is, I find, a good way to start. At least they educate themselves and ask the right questions, so when the individual tries to manipulate the situation, they know how to answer.
Yeah, it's a great point too.
It really is a cat and mouse game to get them in here. I think a lot of people don't realize that a person just doesn't wake up, okay, I'm going to treatment today. It takes a lot for that person to go through, and families have to understand that they're not just going to get up and go. They really have to be ready and do it for themselves. So educating yourself is a good point, and doing the research for the individual helps. And that's what I find. A lot of families are doing the research before they even talk to the individual and do the tour, and which is great.
Yeah,
you know,
absolutely.
Nothing wrong with that. That's all I just wanted to add.
Thanks, Iggy.
Okay.
I think our aftercare is really important to the program here. I also think that while coming and doing the therapy that the aftercare encompasses, staying connected to the community, to our community, alumni, and then also to meetings or fellowships or anything like that. But really that community is central and key to long-term success as well.
Yeah, for sure.
I think that's something we're really good at.
Just to add to that, I see the clients that come to the aftercare, and I find the ones that are engaged in that program stay sober and clean. It's because of the community, and it gives them accountability. They have to be there I got to be there that night. And if they're struggling, they have a place to go to and talk. You know, that they're not alone. You know, they don't have to be by themselves and fight this thing by themselves. They can come. They have a place to go where there's people that understand, and that's why the aftercare is huge. It's very important.
Yeah. So look for a place that has that.
Definitely,
right?
absolutely. Yeah. If they don't have an aftercare, I wouldn't even waste my time.
Yeah. Well,
for my loved one, anyway. I would want to make sure that that's in part of their program, aftercare.
Okay. So I appreciate you both coming and speaking today. I think, you know, the biggest things that, again, we want the audience to take away today is education is a huge, huge piece of this. You know, doing the research is really important as well. The research is important so then you can find a facility that's best for the individual. And in that facility, you know, really looking for things like accreditation, client-centered care, and continued support within the community, and also, as we said, post-treatment, aftercare, and encouragement to get out into meetings and stay engaged one way or the other. Right? So elements, whether here at A.R.T or wherever, these are just key, you know, concepts that we want to educate our audience on, and hopefully help them or anybody take the first steps in getting help. Okay, so thanks so much, guys.
Oh, you're welcome.
And we'll see you next week.